Welcome back. On June 19th, 2024, Namibia launched the Tripartite One Health National Strategy for 2024 to 2028. This collaborative strategy involves three ministries: health and social services, agriculture, water and land reform, and the University of Namibia. Its goal is to address health risks across human, animal, plant, and environmental health sectors, ensuring the well-being of humans, fauna, and the natural environment. By sustainably balancing and optimizing health, Namibia aims to prevent, promptly detect, and effectively respond to public health threats, including zoonotic diseases such as hepatitis E virus and the ongoing COVID-19 pandemic. On the line this evening, we have the Health Ministry's Executive Director, Mr. Ben Nangombe, to give an in-depth understanding of the tripartite. Mr. Nangombe, good evening and welcome to the show.
Yeah, good evening, NBC. How are you this evening?
Good, thank you. And how are you?
I'm doing well. Thank you very much for coming through.
Talk to us about, Mr. Nangombe, how the Tripartite One Health National Strategy sets specific targets for disease prevention and early detection, and what measurable indicators are related to zoonotic diseases or environmental health.
Yeah, thank you very much. The One Health strategy really speaks to, as the title implies, that governments need to adopt a common approach and strategies in terms of promoting, in terms of safeguarding, and ensuring the health and well-being of human beings, the well-being of our environment, and the health of our animals. So it is for that reason that the organizations that we just mentioned, such as the Ministry of Health and Social Services, the Ministry of Agriculture, Water and Land Reform, the Ministry of Environment and Tourism, are engaging in this strategy. So the idea is really to make sure that we have measures in place to timely detect and respond to diseases. We know that many of the diseases affecting human beings in recent years are of zoonotic origin. That is to say, a disease jumping from the animals to human beings. We have seen, for example, diseases like H1N1 influenza in 2019, the outbreak of Zika, the outbreak of Ebola, and other diseases. So what is basically the strategy is doing is putting those measures in place and identifying areas of cooperation where we are going to strengthen the nation's capacity in order to be able to detect on a timely basis and to respond. You made reference to the hepatitis E virus, for example, that broke out from 2017 to about 2019, 2020, which Namibia successfully overcame. There are others such as the Crimean Congo hemorrhagic fever, there is anthrax, for example, there's avian influenza, and there's some vector-borne disease like malaria, etc. So ours is to make sure we put measures in place to avert morbidity, to avert mortality, and equally importantly, to look at the issues of safeguarding the economic well-being of the country.
Mr. Nangombe, what financial allocations or budgetary provisions are outlined in the strategy to support its implementation, and how will cost effectiveness be assessed?
Yeah, basically, for any program that you put in place, it must be adequately financed. For the Tripartite One Health strategy for Namibia, the government will fund this through the allocations made to the relevant offices, ministries, and agencies. As we indicated, there are three ministries involved. There are state-owned enterprises such as UNAM involved, and the resources allocated to them, some of those resources will be then channeled towards the implementation of the One Health strategy. So basically, we are looking at a figure of $4 million annually, and this will translate to about 16 million Namibia dollars over the implementation period of the strategy over 2 years. And it will cover a number of specific interventions and priority sectors, including the activities set out in a program or in a document titled the National Action Plan for Health Security, NAPS, which is being implemented by the Ministry of Health and Social Services.
How will the three ministries and the University of Namibia coordinate their efforts? Are there joint task forces, maybe working groups or regular meetings planned?
Yes, there will be regular meetings. There is these institutions have developed a national tripartite One Health strategy for the years 2024-2028. This was developed with subject matter experts, including, those deals with human health, environmental health, and animal health sectors. There are researchers that were involved, policy formulators at different levels. There is also what is known as a One Health multi-sectoral coordinating committee. This coordinating committee is going to review the tripartite One Health national strategy annually, and the activities of this committee will be integrated into the implementation of the existing strategies, such as the National Action Plan for Health Security that I mentioned. We also are going to look at the integrated disease surveillance and response, issues related to neglected tropical diseases, event-based surveillance, and antimicrobial resistance, because for example, the question of antimicrobial resistance is very important for both human and animal health. And these are issues that are at the front and center of the strategy that was launched on the 19th.
Just lastly, Ms. Nangombe, are there any successful cross-sectoral interventions from other countries that Namibia might learn from, and how would knowledge transfer occur?
You see, Namibia is fairly new at these issues of, for example, establishing the institutions that deal with issues of public health. Other countries in different parts of the world have what they call national public health institutes. For example, some are as old as 70 years, some are as old as 50 years. We are in the process of establishing our own National Institute of Public Health, and for this, we are indeed learning from other countries. In our neighborhood here, countries such as Zambia have established their own, and these are some of the countries that we are going to benchmark with to make sure that we have these institutions in place to coordinate effectively, to coordinate efficiently our responses, preparedness, to public health emergencies that may occur. The COVID-19 pandemic taught us a very good lesson. When COVID-19 came, for example, our public laboratories to test for COVID-19 were non-existent. We first had to refer the samples to South Africa and to Germany. Today, we have established the capacity to test for different kind of infections and pathogens. We are able to do what is known as genome sequencing to identify the specific virulence that we are dealing with and the pathogens that are causing diseases. So in that sense, Namibia has already learned. We are already learning from the Robert Koch Institute in Germany, for example, from America, CDC, Atlanta, and from other places. And now we are cooperating quite effectively with an institution that was established at the continental level called the Africa Centers for Disease Control and Prevention. And this is the kind of technical support that we are getting, and we are continuing to do that to strengthen our systems domestically.
Fantastic. Well, Ms. Nangombe, thank you so much for your time this evening. Thank you for joining us here on the Daily Roundup.
You're most welcome. Thank you very much.
That was Mr. Ben Nangombe, the ED of the Ministry of Health, speaking to us there on the line. We'll be right back shortly.